is an article about the importance of taking your vitamins. It's published by Bariatric Advantage. It's kind of a dated article, but it's still important information.
Okay.
I wasn't sure if you were interested in both or if you were leaning one way or the other towards the Roux-en-Y or the BPD, so I printed the Roux-en-Y. I printed both.
Won't she tell me like what she recommends for me
Yes,
personally?
yes,
Okay.
yes. So I printed the recommendations for both. There are specific vitamin requirements for both. So
Is these it?
yes.
The B12 and all?
Yeah.
Okay.
And
so do you start taking them before or just
you should
as
start
her?
taking them now.
Okay.
Yes, because most people are deficient when they go in for surgery, and the surgery makes you more so. So
Okay.
we'd like to get those numbers up before you have surgery.
Okay.
So the first 2 pages of the Roux-en-Y, the second for BPD. We just changed these and got approval last week, so I don't have them copied front to back or anything yet. But I wanted you to have the information. This one's going to be a lot more expensive, and patients need to know that.
Is this the
BPD.
what is it?
Biliopancreatic diversion with a duodenal switch.
I don't want the duodenal
Okay.
switch.
This one is still a malabsorptive procedure, so you need to make sure that you understand that and that you're prepared to pay for the vitamins, because they can get expensive. But the way I tell people to look at it, you're spending a lot less money on what you're eating, so it should even out and you shouldn't notice a difference.
My whole thing is that my problem is I don't eat. I don't eat enough.
Okay. Well, the doctor and the dietitian will talk to you about that.
Yeah, my doctor
We
doesn't
either
like it.
we're taking in more calories than we're expending, so we need to get more movement then if you're not taking in that much, because the law of physics is what it is. So anyway, you just have to be prepared for your vitamins.
Okay.
These are the things that we've gotten so far, the things that are checked off, the things that are yellow. I still need, as of this morning, we need a letter of pulmonary clearance. I did get the report that you do not have OSA, but because of your insurance, I still need a statement of clearance. Okay, so that can come from your primary care, as the other 2 did, since you were cleared. Okay.
I went because I got that envelope Thursday, and I called them Thursday, and I did a walk-in on Friday, and they assured me that they had everything.
I just did this morning, hon, so I'm telling you, this is as
call
of
them again.
30 minutes ago. I need a statement of clearance. Again, I got the report.
So is this mine to take to them?
Yes, this is yours to
Okay.
take. I made a copy for the chart.
Okay.
We still need 3 more months of diet history. I've only got March, May, and September.
I think she just from March to May, from May to September, but because I've been going every 2 weeks since.
I've got to have the records.
Okay.
Okay, so if you've gotten that fills in the holes, perfect. That
I don't personally have them, but I've been going.
then they should be able to provide that.
Right.
Sure. Now that's not to say they didn't fax something this morning, but I worked all day Saturday and I didn't get anything as of that time. So
Okay.
we still need that. I still need a dietitian evaluation by a registered dietitian, and we don't have your psychological clearance, and they need to wait for 2017. Okay.
They need a who?
A 1 wait for 2017. That was on the list that she sent you, that you got just recently. You must have been scheduled pretty quickly. Usually people get that several weeks before they come in.
This?
Mm-hmm.
Well, I was scheduled to come here about last month sometime, but I did all that throughout since from February up until now.
Mm-hmm. Okay,
So I
well,
don't
you
know
just
why
might talk to the doctor and let him know everything in yellow.
I'll
I
go see
still
her
need.
tomorrow.
Okay,
So,
because after today, with today's dictation, and I need all of this stuff to be able to submit to insurance. So as soon as I have everything in yellow, we can turn around and submit it and get going. But I
okay.
can't do anything till I get that.
So I can't get. Okay.
Okay, can't schedule surgery or anything because I've got to send all this stuff into insurance.
Okay.
Okay. Okay, this is the smoking waiver. It just states
I
that
don't smoke.
we don't allow smoking in any way, shape, or form. So I need you to sign and date that, and I will make a copy for the chart.
All right, guys. So just waiting on the doctor to come. We in this little bitty office waiting. I guess I'm physically not cleared. Am I not cleared? Nicole cleared me, but they not clearing me. Because So that means the appointment that Nicole gave me is not true then. The December the 19th. So y'all, December 19th is not the actual surgery date. My doctor was incorrect. I'm cleared from her, but I'm not cleared from here for surgery. So we'll see what the doctor say here when she come in or we go back or whatever. And I will come back and talk to y'all. Now, I'm going to ask her, can I tape? If she say no, I'm going to sneak and do it anyway. So y'all probably just going to see the floor or the desk, and I hope it's okay. But y'all not here for all that. Y'all here for the information. And hopefully it'll help somebody make a decision. It just look like I got gray hair everywhere. I do. Oh my Jesus. I'm getting old, y'all. But anyway, we'll be back when the doctor come in. What's the matter? Alright guys, they transferred us to another room. They got me in this weird chair. It's weird to me. My feet don't touch the ground. They barely touch the ground. But anyway, we're here. I'm glad they don't have like a lot of pictures of like weight loss stuff. Like, this is you now, and this is what you're gonna look like in 6 months. The evolution. Was I supposed to look at that by myself? Or the doctor gonna look at it with me? She brought a book in here, right here. I don't know if I'm supposed to flip through it, but I already picked the one I want. The doctor might pick something different, as long as it ain't the dual switch, which they say you lose the most weight with that one, the fastest. But I'm not trying to lose it like that. I want my mind to stay on the same track as my body. You lose a large amount in a very small amount of time, you start having psychological problems. So I've heard. This is only speculations and hearsay. When the doctor come in, I will hand the camera over to baby, and she will carry on.
At it, or just that's the one you feel most comfortable after reviewing everything?
Yeah, and that's the one like me and my doctor talked about.
Okay.
We talked about the other ones, but like the dumping and all that, I didn't want to.
Well, the dumping is more likely with the gastric bypass. So we'll go over everything to make sure you're making the choice that you're most comfortable
But
with.
she also said, whatever, like, talk to you about it, whoever my surgeon is.
Yeah, I think we should talk prior. Now, do you have trouble with heartburn or anything like that?
I used to years ago, but I haven't had any.
You haven't had any trouble, and you don't take medications for, you don't wake up with stuff in the back of your throat, any of that kind of stuff when you sleep at night?
No.
Okay.
I used to years ago.
Okay.
Before my gallbladder was removed.
Okay, and then the gallbladder took care of those symptoms okay, so it probably was your gallbladder then.
Yeah.
Okay, and not diabetic, no real too many medical issues from your weight at this point yet. Okay, good. And is this about where your weight lives, or are you up, down?
I'm kind of where I was 2 years ago.
Okay.
Where I was when I started this whole process is the biggest I've been.
Okay.
Other than when I was pregnant.
Okay.
Because I gained 100 pounds
With your baby.
overnight.
Okay.
Like, we don't even know.
Okay. And how many, do you have one child, or are you planning on having more? Okay, so we're done with that. Okay. Okay. And did your family doctor do your 6-month diet, or who did your 6-month diet? And who is your family doctor? Sorry.
Nicole Dillon.
Okay. And you live in Lawrence, is that correct? Okay. Okay. So did you lose any with her or not?
Yes.
How much did you get down?
I went from, when I first started, I was 484.
Okay.
And then I think I'm at
440.
I said, they didn't weigh you. I said, they didn't weigh you,
Yeah, they do. You're 438 today.
Mhm.
Yeah, so you're down about 50 pounds with going through her program and stuff? Good.
Yeah.
Good.
I didn't want to do it too fast. Plus, I worked out like
Oh, good. Good.
from February
Good.
the 21st. Is that what we started? It was an ice storm. I will never gonna forget.
Okay.
Up
Okay.
until
Okay.
now.
Okay, good. So you're still staying active, doing stuff.
Yeah.
Good. Okay, well, let me take a listen to your heart and lungs, and then we'll go from there.
Alrighty.
You just breathe normal. Have you lean forward for me? Take a deep breath. And out. And again. Okay, just breathe normal. So other than the gallbladder, any other belly surgeries?
No, ma'am.
Okay. It's coming up slowly but surely. I'm gonna bring you back.
It's gonna hurt.
No, I'm just taking a feel of the belly. It's not gonna hurt.
No, I'm saying that.
Oh, your back? Do you have a bad back?
Yeah.
Okay.
Oh, will you go through these?
I'll be able to use some of them, not all of them.
Okay.
The ones I can, I will, but obviously I can't. Some of them aren't positioned where I would do your surgery.
And I got one in my navel.
Yeah. So if I go to where it doesn't work well for my surgery, then it makes it harder. So it's better to do what technically makes it the easiest for us to do it, kind of standpoint. Well, this is what I would talk to you. You are young. You hopefully have another at least 50 years of living here to go for it. And so I just like diabetes is different in some patients. Like some people have a hard time controlling it. Some people it doesn't take too much, and high blood pressure, all of those things. I think obesity has degrees of severity. So if you're a person whose BMI normally lives about 40, I think that is a little bit different than a person who tends their weight tends to be more that BMI of 70 or above, and that's where you sort of fall into that category. And so our goal is try to give you the best tool that will help you be successful for the rest of your life.
Okay.
In every one of the surgeries I do, people lose weight, but all of them have a potential of weight regain.
See, that's not an option.
Well, it's not, but I'm just telling you, this is life. I'm just telling you, I give you a great tool. I don't cure a disease.
It's not overnight.
So this is what I would say. What I'm trying to figure out, what is the surgery that will hopefully get you your best long-term control of your weight. And the gastric bypass certainly can do that, but my experience has been as patients get heavier, it may not do as well long-term for that patient. And so each of the surgeries I do, the upfront risk are exactly the same. Long-term risk and how well weight is controlled is different for each one. And so this is of course the gastric bypass or the Roux-en-Y. You make a little stomach, disconnect it from the rest of your stomach. This used to live down here. So food comes now into this little stomach. It no longer comes in this part. This part here helps carry it. This part here doesn't see food. So there is a little bit of malabsorption
So
with
will
it.
the big part of your stomach stay?
It stays. We don't take it out, and it's okay because food doesn't go there anymore.
Right.
It makes its secretions and things come down.
So why do they keep the big part?
Because it'd take more surgery to remove it, and there's no reason to remove it because it still stays there and works and stuff. It doesn't digest anything though, because food doesn't go there anymore. So this surgery usually takes about an hour, hour and a half to do. And its upfront risk are infection, so we give a dose of antibiotics, bleeding, any of these cut edges can bleed, and you're a little higher risk because one of the risks is blood clots, and so we don't want you to have a blood clot, so we give you blood shots to prevent that, a blood thinner. So because we give that, it does increase the risk.
So do I have
of
to
bleeding.
take that the rest of my life?
Oh, no, just during the surgery, and then you would go home for the first 2 weeks because we don't want you to get a blood clot when you go home. So that's what, that, and then if I could do it through little cuts, I'd have to make a bigger open cut. It's long-term risk. There's a slight risk of a thing called an internal hernia, and what that means, anytime I move intestine around, I have to divide the fatty tissue. There's a little hole left in that fatty tissue. I close it up, but can it open back up for a patient? So, and then the concern with that is small bowel's always moving around. Could some small bowel come and get stuck? The likelihood of that is about 5% for the rest of your life, not real likely. And he's like, well, how do you know if I do it? Well, all of a sudden you start having bad belly pain and you're nauseated with it. It's an easy enough thing for me to go back surgically and fix, so not usually a big thing as long as you don't ignore it. Of course, you gotta be good about taking your vitamins, you gotta be good about eating your protein, cause you can have some nutritional deficiencies if you don't. So that, forever, and you get labs checked a couple of times the first year, then
And I come here and
well,
see-
you can have the blood drawn there, but yeah, we still wanna keep an eye on you to make sure you're losing and doing well. So I usually see you at a week, 10 days, and we see you at 6 weeks, then 3 months, 6 months, 9 months, a year, and then yearly from there on if you're doing okay.
Okay,
So that's sort of the pattern of it.
okay.
Long term, you can't take things like ibuprofen,
And that's what I
Aleve.
take now,
Yeah,
so what,
you can do extra strength Tylenol, but you can't do those other things.
okay,
And because you're a little higher risk for getting ulcers in that little stomach, the risk of that is about 5%. And if you take those medicines, though, it increases it. You don't
Okay,
smoke
so-
or,
no, I quit smoking 4 years ago.
good, okay. So that is,
Oh, 5, I mean, 2015.
yeah, so good 3 years ago, so you got off your cigarettes, good. So, but that's something for the rest of your life kind of standpoint.
Okay,
So that's that surgery. You usually go home the second day after surgery.
okay.
The other one to consider in your case, because it shows fairly equivalent weight loss, a few percentage points, not much difference, is a sleeve gastrectomy. And probably the other one, there's a couple reasons to consider this one for you. Up front, exactly the same risk.
Okay,
Long term, you can take things like Aleve, ibuprofen, naproxen, because no higher risk for getting ulcers once it's healed. So, of course, with this one, you are taking out that lateral part of the stomach. There's no rearranging your small intestine, so there's no malabsorption with it.
okay.
So people will usually take off 60 to 65% of their excess weight. You get one incision like that, 4 little ones like this. With the gastric bypass, you get 4 like this and 2 like this. So pretty equivalent. This one you usually just stay overnight and go home next day. So its upfront risks are exactly the same, but long term, we don't have the risk of internal hernia, we don't have the risk of ulcers. And so that is a good option for patients too. Now, the main reason we may want to consider this one in you is because you're 35, you got a lot of years of living,
I just
hopefully.
turned 36.
30, well, you still got a lot of years of living. Is that if you didn't lose as well as we'd like, or more importantly, if you did not maintain as well as we'd like, I can convert this to a DS where we do add in a lot of malabsorption. Whereas if I'd done the gastric bypass, I can't go back to a sleeve. So the second stage surgery, or third surgery to consider in your case, and is the most aggressive of all the surgeries I do, but it has the most weight loss and the less risk of weight regain, with because there's a lot more malabsorption with that one. Where the heck is it at? If I can find it, will be good. There it is. So the DS has, and this is called a DS, or a biliary pancreatic diversion with duodenal switch, has 2 components to it. You make a sleeve, like we did on the other thing, but this used to be connected here, and this used to live down here. So this one here, food comes in here, this here just carries it, it doesn't digest. This here, which is the majority of your small intestine, no longer sees food. And it's not till it joins down here that you actually digest your food, and you make that about 150 centimeters. So that's why this one has the best weight loss of all of them. Most people will take off about 80% of their excess weight and have less risk of weight regain as it gets easier to eat. So, but the flip side of that is you gotta be really good about eating your proteins, you gotta be really good about taking your vitamins, because you can have potential more issues with that if you aren't good about it. So that is the disease. And the reason I started doing this one, because first I started gastric bypasses, then added in others, is because I would see the patients who'd have a gastric bypass, they would lose quite a bit of weight, but they still might be 100 pounds overweight because they started so heavy. And so this one probably, it definitely does a better job, but you gotta be good about the nutrition. Now, most people, do you have trouble with diarrhea or any of that?
And I have trouble going.
You have constipation?
Yeah.
So most people, because you don't absorb everything, most people average about 3 stools a day, 2 to 3. Some people can have 6 or 7. Usually you adjust that with medicine. Now in your case, probably not as likely since you have more of a constipation issue, it'd probably be more like 2 or 3.
So with your gallbladder being out, which one is?
Gallbladder doesn't do anything with any of them, doesn't affect it. Gallbladder's purpose is just to store your bile, but your liver makes bile like normal, so there's nothing I would do differently with that.
Okay.
So that wouldn't impact it. So to me, the main reason of the different surgeries, bypass versus sleeve would be with the sleeve, pretty equivalent weight loss between those two. You don't have reflux. If you have bad reflux, we would probably want to do a sleeve because then they can have really bad reflux. The nice thing about you, if you had a sleeve, is that you could still take your Aleve and Naprosyn long term, and you can't with the bypass. The other thing is that if you didn't do as well as I would like long term, or you had issues, we could add this part in because I've already done the sleeve. Now I'm just adding in malabsorption. Now, you would meet the requirement to even consider, do we do this one all up front and do it? And each person has to decide where they feel most comfortable on that one.
I thought I had it all figured out.
I know. Well, this is the time we gotta make the decision that
So
you'll do well with long term. The gastric bypass, I would say I would probably tend with your heavier BMI and you're not diabetic and you're none of those, I would probably tell you to consider the sleeve over that because you don't have trouble with reflux, and we see pretty equivalent weight loss with the sleeve and a bypass. The thing I like about the
and the sleeve is you can convert it into this if need be.
if I needed to.
So the Roux-en-Y is kind of out.
Well, I can still do the gastric bypass. I would just tell you, if you think about it, if you realistically have about, not quite, probably about 260, 270 to lose. If you're saying, that would get you back down to about 170.
So that's where you would be comfortable with me.
170, I mean, each person has their, do I think
Mine was 200 and my doctor's was 200.
Yeah, no, I think 200 is fine, but I'm saying if you're, at 170, at 5'6", 170 is still not like I'm making you too skinny.
Yeah, I don't want to look
No.
sick.
But I'm just telling you, 170, 175 at 5'6" is still you would still fall into the overweight category, but probably you would be comfortable with that weight. That if I say at 170, we'll do the math here for you.
Cause my mama 170, but she's 5'3".
Does she look a little heavier with it?
A little bit.
Yeah.
But when she got down to like 150, she looked sick, and everybody thought she was taking drugs.
It's all people's perception of where you're weighed and how you carry it. But like I said, I'll make you 175. I'll even do 200. If I said 200, then that still means you have 238 pounds to lose.
Right.
Yeah, realistically.
Mm-hmm.
So if I gotta find my darn calculator. Updated my phone and it's jacked me up. Should not have done the
I
upgrade.
always do upgrades.
There it's hiding. Okay, so if we take 238 and I take that times, I'll even be generous and say we're gonna lose 80%. And that's probably, most people average about 70%. So if I do that, that means you're gonna lose 166 pounds. So, which is good, but that would still leave you about, because we talked about we'd want to lose at least 200 pounds, or not quite 200 pounds.
I want to lose the 230.
230, so 230, so that would still make you about 70 pounds overweight statistically.
But that's
So-
a statistic, like realistically not falling into society's category.
No, I'm not telling you bad, I'm just telling you what I would expect you to lose with the gastric bypass. Do I have people lose all of it? Yes. And you're gonna lose weight. And you're gonna lose about that same weight with the sleeve. No question, you're gonna lose more weight with this one. Now, you may not like how thin it would get you because you view yourself at more 200. So that's
Well,
what,
I mean, I've never been, in like the 5th grade, I was 200 pounds.
Yeah,
I don't know how it feels to
Yeah,
be.
yeah.
And I might get to 200 and still not be happy.
Yeah.
Well, I mean, I'm happy now, but you
Right.
know what I mean.
Yeah,
Like,
no, I understand.
still feel like,
I'm just telling you, those are the numbers. And so, one option would be, Medicare usually will pay, I think, one time for weight loss surgery. So it's a game we sort of play with. Do I have patients like yourself who I'd say, okay, I schedule them for this, we get insurance approval for this, but I go in there knowing I'm going to only just do the sleeve, because I'm going to say, and probably that's all I would be able to do anyway, because you're still carrying quite a bit of weight here for us. And so I would just do the sleeve portion. But you have been approved insurance-wise for this. And so that in a year and a half, if we've tapped off on our weight loss and we can't lose more weight, then we've already had insurance approval, we can go back and add this part in.
so then do I pay the difference?
Well, it would be, you'd have whatever your copay from that standpoint, but
I don't have a copay.
well, then you'd be whatever you're with that. So this is what I'm just saying, it may be better to say we're considering this one, but I know I'm going to just do a sleeve and install what's called an aborted DS, which I think I'd have to anyway, because you're still carrying quite a bit of weight. And know that in a year and a half, if we're not happy with our weight loss, or maybe we will be happy, and that's all we have to do is a sleeve. But if we're not, I would already say, okay, we're going back now and doing that second stage of the surgery where I add the malabsorption in.
Okay.
So that's what I'd probably say, because you're 35, you got a lot of years of living. I do not cure your disease. And you know better than me, if you were 200 at fifth grade, it is a chronic disease. Now, any of the surgeries I do for you to do well out forever is making lifestyle changes. I always tell people, I change this, you gotta change this. And I'm glad that you're exercising already. But, obviously you're gonna eat lots, smaller portions, because
Well, I'm
Your stomach.
working on that now, because she got me eating.
Good.
In this, what is the 7-inch?
Good.
The 7-inch.
the smaller plate, yep.
Mhm.
It'll be a lot easier when your stomach's little.
Well, see, when I went from what I was doing,
Uh-huh.
because I was raised, you eat what's on your plate.
Yeah,
So I make the food, but she make the plate, so I eat what's on my plate.
yeah.
I was always, and
Yeah.
I have to retrain myself
Yeah,
that you
and
don't
the
have to
little-
eat. It's okay not to.
You can have leftovers.
And then
Yes.
so now I'm doing the 7, and then you find yourself like getting really full.
You learn to eat differently.
It's like your eyes is not as big as you
And,
thought they
and,
were.
and that is part of it. I tell patients, early on, you'll be able to eat a quarter of a cup with this surgery. Long term, it gets more about a cup, cup and a half. So early on, you're gonna do 5 or 6 small meals to keep your protein up and get your nutrition, because we wanna lose fat, not muscle.
What's considered to be like.
Well, when you're making your food,
Mm,
you want half of that food should be solid protein. Chicken, fish, beef, obviously
I don't eat
grilled.
pork.
Grilled is better than fried and all the stuff we know about.
Mhm.
And then the rest is healthy fruit and vegetables. And the
Because I was told not to eat fruits at all.
well, this is what I tell people. Google fruits and vegetables low in carbs. And they need to be your to-go-to fruits and vegetables.
Okay.
Because you're right, oranges, bananas,
I can't
high in
eat
carbs,
oranges.
high in carbs. But you can get strawberries, blueberries, apples, things that aren't so high in carbs are choices.
Okay.
And then there's fruits, vegetables. I love corn, but corn is not good for us.
Okay.
And the 6 food things that I tell patients need to fall into treat categories is potatoes in all its forms, pasta, rice, bread, chips and crackers, and ice cream. And it's not that you can't
I was
have
hoping
those,
she did not say ice cream.
but those are your treats.
Yeah.
Those are treats. And what I tell patients is once a week I get to have a treat that I
I
don't
can
normally.
clear out all the rest of that, but my ice cream, that's just like.
But you gotta get that. It becomes it's a
it's
treat.
hard.
It is a treat thing, and that this much of it is just as good as this much of it, and getting your head wrapped around that. And that is part of the, as portions get bigger, and usually about 3 to 6 months, I can eat a cup, cup and a half. Then I'm 3 meals a day with 1 protein snack. And
What's considered a protein? What's
protein snacks, it
Is
could
it
be like a boiled
more-
egg, it could
Oh,
it could be some little piece of meat, it could be a protein bar, it could be a protein shake, it could be a little piece of cheese as long as it's low fat, but to get your protein in. kind of standpoint.
So everything is really just protein based.
Well, it's not excess protein, it's just that you're eating smaller portions, and what we're cutting out is the other stuff.
Mhm.
And then learning, even now to start, once a week I get to have some ice cream, but I don't get to have the rest of the week.
Okay.
And getting that as my treat, and whatever day that is for you, Sunday, whatever, what do you wanna say? I can have it, and you know that 15, 20 bites of it is just as good as 80 bites of it. And getting that into your mindset.
So is the fruit, do you know how they have like the all natural fruit bars?
Just gotta look at carbs on it, cause it comes down to carbs, it can be very tricky and stuff, so you gotta look at the carbs on the reading and stuff, and see how many carbs are in it.
Will you give me something that says, stay within this?
Yep.
Okay.
Well,
That's my whole issue, and my doctor is like, I'm not gonna do the work for you, but if I'm telling you, I'm not understanding.
well, we can
what
help
you're
you set you
saying.
in with a dietitian, cause you have Medicare.
Mhm.
I think we can hopefully get insurance approval for that for you, but maybe we can get you in and see Mary Beth Penny, and she can give you examples of stuff.
Yeah, because I was in the store and she was like, don't eat this, but then
Yeah.
she's like, you can have brown rice. And when I looked at the brown rice box, it had just the same as
Well,
the white rice
Well,
box.
it's better in how the absorption, but like I said, that falls into my treat category. I don't eat a lot of that, maybe. And potatoes, I grew up eating potatoes all the time too. We had it at every meal, pretty much, except for breakfast. But you gotta realize potatoes have no nutritional value for us.
Because I thought I was doing good. I'm like, I had a salad with chicken, grilled chicken, and she was like, salads is not as good as you think because it's water based. I'm like, here I am thinking I was doing.
Salads are not bad. Now, it depends what dressing you put on.
I was using the vinaigrette, but
Okay.
then I used
Right.
the
It's just like all of that. You gotta look at, it's always calories in versus
but then
calories
I
out.
used the ranch, but my mama said if you're gonna use the ranch, don't soak it in. You just
It's still the
Which-
ranch. It's hard not to put enough ranch on there and then get it.
well, I
Do you
put a
like the
little
low?
bit.
The low fat ranch is better.
Okay.
Yeah.
I
So-
haven't tried it, but I used to soak it in
Yeah.
the ranch.
Yeah, yeah.
And now I just use a little bit, and I'll be like, you just supposed to wet the lettuce, not soak it.
Yeah.
You know.
Yeah, it's a lot of lifestyle changes, no question. So I
I'm
will.
ready for it. It's just that my doctor is not hearing me when I say I don't understand it. Everybody learn
Different, yeah, and like I said, it would be good for you to go Google online fruits and vegetables low in carbs.
Okay.
And that will help, because that will give you choices. And then look up proteins, high in protein sources, because that will also tell you, oh, I can do beans, this is how much I get from beans, this is how much, it's not just meat, there's other things too. Eggs are a great choice of protein.
So what makes it better, scrambled eggs or the boiled? When you
Boiled is good too, either one of those are good, as long as you don't put a lot of oil.
But
like-
she said use like Pam.
Yeah, I knew that, that's what you do, just get some of that or olive oil or something like that that doesn't have a lot, the spray and stuff. So all of those things for it. And there are, if you go online, there's a lot of dessert recipes by people who've had weight loss surgery. If you go online, that gives you good recipes and stuff too.
So question, I have some like aftercare questions.
Mhm.
So with the one that you're recommending, I have to stay in the hospital for 2 days?
No, this one, if I do all of this at the same setting, you'd stay 2 days. But my plan would probably be, we're gonna say we're doing this one, but I would probably just try to do the sleeve portion only.
Mhm.
That way we already have insurance approval down the road.
Mhm.
You usually just with the sleeve stay overnight, go home next day, if you're doing okay. And then, the risk, like I said, the risk that we worry most about is a leak.
So
Anytime I staple something, there's a risk of a leak. With the sleeve, risk is about 2%, and it's not forever risk, it's about first couple of weeks, but when you go home, if all of a sudden you're not feeling good, you need to let me know.
Okay.
And you're on clear liquids for a week, 2 weeks of full liquids, and you get all of that.
Do you have that now?
Yep,
Because I wanted to practice, and I've been trying on my own, but
Yeah.
I don't think I'm doing.
Well, they can give you the book of the DS, but you're really gonna do the sleeve portion, but the early eating is exactly the same, it's a week of.
Because I've been doing like, for breakfast, I'm trying to like work my way up to it. I'm getting my mind ready for it. Just like blending fruit with unsweetened almond
Yeah,
milk and a spoonful of
Protein.
Greek yogurt.
Yeah.
I didn't know what protein to use because I was in Walmart like, is
Yeah.
this it? And she was like, just ask and we go.
Well, I would say it doesn't really, what you wanna do is just make sure whatever protein you get, it's just low in carbs. Because you gotta be tricky, they hide it, and you want to get the one that also will give you a good amount of protein,
I just know it had 1 gram of sugar.
Okay.
Because she drilled in my head the
Low,
lower sugar.
the better you are.
possible.
The better you are.
You had, I think it's
I don't
10
remember.
protein,
Yeah.
60
No, it was
calories.
30. And so what about the Ensure?
Ensure, you gotta be tricky with Ensure because there's a lot
It
of
said
other.
I've seen it on the TV. It was 30 grams of protein and 1 gram of sugar. The one
Okay.
that came on the TV.
Okay, you just gotta look at each one, cause some people take Ensure because they need to gain weight, so in those patients, it's gonna have more sugar in it. So you just gotta look at you gotta look,
It said 1 gram of sugar, 30 grams of protein.
yep, that's the reasonable one to do, anything less than 3 or 4 grams of
So would
sugar.
does that like take the place of a meal? Like
You can,
drink that for breakfast
You
and
can.
have a lunch and a dinner, or
Yeah.
eat a breakfast, drink that for lunch, and have.
It doesn't matter which one you wanna order of it, the main thing is, and sometimes you just gotta get something, especially now before you have surgery, sometimes those liquid things go through you really quick and you're tempted to snack. So sometimes it's better to eat some
Like I
solid
was
stuff.
telling her, and she don't know me from a can of paint, but you know, when people see plus size people, they just assume that they scarf a lot of stuff down their throat.
Yeah.
And I'm the total opposite. Like I hate food.
Yeah.
And so, you know, it's hard for me to do a 3 meal a day. So I'm working my hardest.
It's
at-
better to do 3, and a lot of people are grazers. And I don't know, a lot of people who have weight issues, they don't eat a lot at a time, but they graze through the day more, and so that part needs, if you're,
I just eat dinner. Like I used to be on the go in school, and then I had a daughter, so I didn't have time for breakfast and lunch. And by the time I'm like, I didn't eat nothing. It's dinner time.
Yeah.
So it's not like let
Well-
me make up and eat more because I missed.
well, I will tell, part of it is being completely honest with yourself, because it is calories in versus calories out.
No,
And it does-
I'm very.
And so a lot of times, it's not the size of the portion you eat,
that's
it's
what
the
I do.
choice
And,
of what
and that's why.
because you can eat, you and I both know, you can eat something this big and you got 1,000 calories. It
Right.
just depends what you get. Because I myself say, I can go to McDonald's, if I get a Big Mac and a medium fry,
That's like 16.
that's already, boom, I got 1,200 calories there.
Right, you can't eat nothing for the rest of the day.
So, and that's not that much food. Can we
Right.
eat that? Yes. So
So
it-
see, I can eat that and be good all day.
yeah, but that's still more
And
than you
that's-
need, because that's, at your height, you probably only burn about 1,400 calories a day.
Mhm.
And so right then, you got an extra 200 calories. And then every day, if it's something like that, it just adds up on it.
Well,
It's just
we
what
don't
it is.
eat out every day.
No, I'm just saying in general, because it is what it is.
Mhm.
We have calorie dense foods. And unfortunately, a lot of calorie dense foods are cheaper than, you know, quote unquote, the better foods for us. And that's the
So
problem too.
so bananas is high. in
Oh, that's
carbs.
high in carbs. It's like, it's got a
Cause
lot.
I got bananas for my smoothie. So see, every time I think I'm doing something right.
That's why I want you to Google fruits and vegetables low in carbs.
Okay.
Yeah.
So y'all can eat the bananas now.
Yeah, they what?
They not.
Bananas are high in carbs. Yeah.
Potassium.
So anyway, I'll say that we talked about this.
Mm-hmm.
And that, if you're in agreement, I don't make, you know, every patient has to decide whether they're comfortable.
Mm-hmm.
I think a sleeve and a bypass work pretty equivalent for patients.
Mhm.
And you don't have trouble with reflux, so I think you're a good candidate for a sleeve. My main concern is, would you lose as much as we'd want with a gastric bypass or a sleeve? But once I've done a gastric bypass, it's hard for me to convert you to something else. The risk is higher. Whereas if I've done a sleeve, I can convert you to this.
So what's the time frame and what's the amount where you say this is not working?
Well, I'd have to see how your weight's losing. As long as you're losing, we would keep with the sleeve alone.
Mhm.
Most people, if they're gonna tap out, do it about 1.5 years. So if all of a sudden at 1.5 years, and you can lose it all with the sleeve, so we're not going into it, sleeve may do it for you,
Mhm.
but you're also young. And so, it is lifestyle changes, and sleeve may do it all with exercising, changing their eating, it'll do it for you. But most people, if they get most of their weight about 1.5 years. So if we don't lose as much as we want, and more importantly, if I start seeing you start putting weight back on, then we're gonna say, okay, we need to add this in.
Okay, so if you're losing the weight and you're at the weight that we both comfortable
then
and
we-
we maintaining it,
Then we never have to do
do
this.
you remove the skin?
Well, we gotta see if we can get insurance approval for that, that's the
Okay.
issue, that's the issue.
But you will.
If we get approval, yes, we do it, or I refer you to someone to do it, yes.
Well, see, I don't want to go to nobody else because now I'm familiar.
Yeah,
with
well, no, I do it, but I don't say belly buttons when I do it, cause I don't know how to do that, but that would be done.
You have to make a new one?
You just lose it if I do it. So
Oh,
well, you have a
yeah.
plastic surgeon and someone else. Now we don't need our belly button. It
I
has
need a belly button, I don't wanna look weird.
No, but- well, I'm just telling you, that's down the road. So, let me go have Rochelle, maybe see if we can get you set up with the dietitian, okay?
I still got questions.
Go for it.
Aftercare,
Uh-huh.
being real, sex, travel.
Travel, I would
back
tell
to
you,
the
I would
gym.
tell you to wait, no traveling for probably 6 weeks, so I make sure you're doing okay.
Okay.
Sex, usually 3 or 4 weeks before people fill up to that, cause it's sore for my cuts.
Okay.
Back to the gym, I want you to, as soon as you get home, you can go back walking. Now, like
Just
pulling,
walking?
you know,
'Cause
you don't
I
want,
do
you don't,
weight training.
yeah, we don't wanna do pulling on the belly for about a month, cause we don't wanna get any hernias.
So just walking.
Yeah, or you can do the treadmill, or you can do a little stationary bike, but I don't want, and little light weights, but no heavy lifting.
Okay.
I told you no.
Well, I don't do
strings.
heavy lifting, I do 7 to 10 pounds.
Like no squats. You
That's
can't-
Nothing that
you
you're
can't
gonna be
squat
using your
no
belly,
squats.
not where you use your belly to pull up, that's not good for you, you want it to heal first.
Nothing straining. Like
Yeah.
the bed, you
I
gotta
do this.
Yeah.
get up on the bed like that.
I'm really
Can't get
strained
up
when
there.
I do
I take one of the
curls
mattresses
Yeah.
or
off.
these, I'm
Yeah.
really strained.
Nah, not them with the.
But
yeah,
this one I do.
yeah. You might not. You might not want to use
No,
the
you can't do
thighs.
that, you can't, cause you use your belly when you're straight.
Right.
When you do those
Yeah,
things, you use your
this
belly,
or-
yeah.
Yeah,
yeah.
so I can do the curls.
Just do light, and don't do
and
heavy
I can
ones.
do-
Yeah.
I
But
just
you
do
gotta
5
use
pounds.
the two.
5 pounds should be good.
5 would be okay, as long as you're not straining hard. So, other
If
questions?
I get the straining at 10, I think I'm. Oh, one more. Okay, so what if they can't get a vein?
Oh, they find one.
Cause I don't want them to go through my neck.
Well, if, they'll find a vein if they can, they're really good at it, but if someone has to, they have to.
I don't want to do that again.
Well, if you have to, we gotta do what we got to get you, so I can do it, cause you gotta be asleep for me.
Right.
Ooh.
Okay, let me go get Rochelle.
Thank you. Did I answer everything?
I think so.